And my name is Antonio Moran, and I would like to introduce you to Alzheimer's disease. And the reason why I chose Alzheimer's disease is actually because we're not very aware of it. And from what I've seen on my accounts, we actually don't treat people with Alzheimer's very nicely. Before I start, I like to go over the icons right here. We have the purple ribbon, which stands for the Alzheimer's awareness. It happens on the month of November. And we have an irony icon right here, which is an elephant. As the quote goes, an elephant never really forgets. So here's my table of contents of what we'll be going over today. We have the cell communication, how it was first diagnosed, signs of dementia in our brain scans, and finally the medications and diet. And if we still have time, I'll go over how we can communicate with those that have Alzheimer's. And so the reason why I want to go over this specifically is because Alzheimer's, we don't really know the cause of it, but we do know what happens. And our star player right here is actually the APP protein right here. It goes through a certain mutation which tends to fumble the communication within the brain. And because of that, it starts making these tangles right here and starts around here, the pathway right here, actually makes these beta amyloids deposits, which hinder the communication. We'll actually see that later in another slide. And here are all the signs of dementia. We have the icon of memory loss, we have altered judgment, we have problem-solving changes, if you can see up here. We have speech and writing changes, we have mood changes, and we also have social changes. And here's the diagnosis of how it happens back then. So if you can, take your two hands right here, and basically they would want you to try to interlock these hands by copying them. And if you somehow fail, please don't, you will be in the process of seeing whether or not you have a brain disorder. And now, in modern time, we would actually put you through a neurologist and they would actually scan your brain. And as you can see, the brain in Alzheimer's is actually getting quite reduced. The size is incredibly small, and the area that it affects the most is actually the hippocampus. And this part right here is actually responsible for your memory and for your judgment and how social behaviors happen. But that also can reduce the size up in the cortex right there, which explains the reduction in size. The cortex is responsible for everything else. It's actually responsible for your for how you learn a language, everything that happens within your life. And here is a more dynamic images right here. You can actually see the close-up of the deposits happening. The tangles are actually the tau protein, which actually is the makeup of the nerve cell. And because of that, nerve cells tend to strain a lot, and these deposits right here hinder the communication. And because we can't really do anything about that, there is no cure for these nerve cells right here. So here are the medications right here. These are basically artificial brain inhibitors, which will allow you to enhance your memory support. As you can see right here, this one has lucid dreams and memory support. This one right here is coming in 13.3 milligrams every 24 hours. You cannot take more than two capsules, because it has incredible and severe side effects such as vomiting, panicking, stress, anxiety, and you can actually pass out just from having more than the dosage that you are prescribed. Here is the Mind Diet. This is the alternative to how we can prevent Alzheimer's in a lot of people. You can see it is rich in omega-3. Omega-3 is a very powerful protein that enhances your brain also. You can see that you have all these seeds right here, these fresh oils, and you can see it a lot in river fish or fish in general. Shellfish, salmon, you can see it in crab also. And lastly, I want to go over the stages and how we can treat people with kindness and all that. We have three main stages. We have the mild, the moderate, and we also have severe. The mild basically has a little bit of a brain fart. You can have a brain fart every once in a while. You're on that stage if it happens very, very often. In moderate, you have the icon of the Alzheimer's. You have trouble remembering certain stuff. You don't remember some names. You have very, very poor judgment. And then severe is where everything happens. You cannot sleep normally, you cannot eat normally, you have to be accompanied at all times, you have to be taken care of. It's very, very hard for a person with severe Alzheimer's to live by themselves. would like to close this with how we can interact with people with Alzheimer's. As you can see, we cannot stop visiting them just because we need to give them courtesy. We have to use their actual name, and we have to avoid quizzing them on what they may or may not know. And please, please, if you are going to go out there and interact with somebody with Alzheimer's, treat them like a normal human being. Do not treat them like a child, and do not speak to them like a child. They are just as an adult as you are. And I would like to close.
Very good.